Hi, I'm Rochelle Haynes, Director of Corporate Communications for AdventHealth West Florida Division. Each October is a reminder for us to get a mammogram, a routine screening that can save your life. Our experts have the most state-of-the-art medical equipment available to diagnose and treat breast cancer patients. Today, we're speaking with Dr. John Cox, a leading breast surgeon at AdventHealth Tampa, who says this topic is important for women and men. Dr. John Cox, a leading breast surgeon in the Tampa Bay area, who we have the blessing of having the expertise and compassionate heart with us at AdventHealth Tampa, joins us today to talk more about breast cancer. Dr. Cox, thank you so much for your time today.
Thank you.
You know, this disease is not just about women, though, and we do have a lot of men who will view this, and the fact is that they're not immune from this disease, are they?
No, that's true. Although it is much more rare in the male population, it is certainly a serious thing. That the nice thing is that the breasts are much easier to examine, and oftentimes we can catch it earlier, but it's still a very real concern for certain men, and there are certainly people who succumb to the disease that are male. So yeah, it's very important for all of us to take our breast health, seriously.
You know, and something that the men watching this, may want to understand too is their children. So if you're a man and your wife has breast cancer and they do test positive for the BRCA genes, what's important for these husbands and fathers to understand about that?
Remember, the BRCA gene could come from the mother or the father, and so it's what's called heterozygous, or mutations are where it comes from one particular side of the family. So you're not immune to passing on that disease, and also the BRCA gene in men carries a higher risk for breast cancer, and most of the male breast cancers do carry the gene, but also it carries the risk of colon cancer and other forms of cancer.
What are some of the advancements that you are making or that you see being made that are helping your patients fight this?
Certainly the treatment and understanding of breast cancer in my career, I would have to say, has gone through the roof. Particularly when it comes to the very deadly forms of breast cancer, including what's called the triple negative breast cancer, and also the human epidermal growth factor 2 type cancers, or HER2 positive cancers. There has been just dramatic increased response in the chemotherapy option, and the putting liquid to cure cancer. We never really thought that was going to happen, but I've seen it in my career to where we thought what was once a deadly cancer can now be almost contained with some of these chemotherapy options.
Well, thank you again for joining us today. We appreciate your time and your work so much.
Oh, thank you very much.
For more information on how to find the leading care at AdventHealth in Tampa Bay, go to yourcareexperts.com.